Hi, it's Dr. Brian Taggy, and today we're going to talk about preventing nosebleeds. A lot of people coming in during the dry summer months and sometimes in the wintertime when the furnaces turn on begin to have nosebleeds because of the excessive dryness that's in the air. Now, this is a common condition, and most people have had at least one nosebleed during their lifetime. But some people have frequent nosebleeds, and they'll oftentimes come in and ask, how can I prevent them from occurring? Are there certain measures that can be done? So today let's talk about that. And so what is a nosebleed first? Most nosebleeds occur just barely inside the nostrils, up on a structure that's called the septum, in an area that's named Kisselbox, where there's a superficial vasculature or a plexus of vessels that are located there. So these vessels can be superficial, and if they crack, think of the desert sand, for example. When you get a dry desert and the rains come down and then the sand dries out, you get little cracks in the sand. If you get a crack on a vessel, then that's an open vessel, and an open vessel is a bleeding vessel. Now, sometimes people are predisposed to nosebleeds because they're taking blood thinner medications, some people taking aspirin or other heavier type of blood thinning medications can have more nosebleeds, and it becomes really manifest inside the nose and these bleeds. Another is high blood pressure. The pressure inside these little vessels, if higher, can have a greater tendency for bleeding as well. So those are measures that you might want to check into and control or solve before taking some of these other measures. And so to prevent them, here are some of the things that you can do. First of all, absolutely make sure that you don't manipulate the inside of the nose. One of the most common causes is you'll get, as you manipulate or pick these little scabs from the nose, that can be quite troublesome and not very fun because they kind of block the airway. So people will reach up with their finger and pull away a scab, and as that pulls away, that opens up and carries with it the top layer that then exposes the undersurface, which is more filled with those capillaries that I was talking about, and that will cause the bleeding. So you leave those crusts and those scabs there, allow that area to heal, you'll get less bleeding. So zero manipulation inside the nose. Saline spray has been shown to help. So if you're in a cycle of frequent nosebleeds, then using saline spray every 2 or 3 hours is a common first line of therapy for frequent nosebleeds. One of the most important parts of preventing the nosebleed is humidification. And oftentimes there's more drying that occurs at nighttime when you're sleeping. So I encourage patients to use a humidifier right by their head at nighttime, and that'll allow humidification of the air that you're bringing into the area. Prescriptions. And so mupirocin is one of the most common, and I have found probably one of the best topical ointments that you can put inside the nostril, just barely up inside the nose, once or twice a day, and within 7 to 10 days, there's really good healing that occurs in that area that can be damaged from the excessive dryness or from the excessive manipulation. Mupirocin ointment, and that's a prescription that's given to you by your physician. Now, if there's still problems despite the conservative measures, then you can take to cauterization. And I think most people have heard about cauterization of the nose. And so this can be done in the office. The first option for cauterization is not as aggressive, but it does oftentimes help individuals solve their problem with nosebleeds. It's called silver nitrate, and that's a chemical. And this chemical is sort of a burn, if you will, not electrical burn, but a chemical burn to the area that'll constrict and obliterate those vessels and cause them to sort of involute and decrease the bleeding episodes. Now, a more aggressive and more successful way of cauterization is the electrocauterization. And of course, electrocauterization requires an injected anesthesia. In other words, numbing medicine that you have to apply inside the nose. So some people will elect to do this in the office, which I do a lot of. Some people will elect to be sedated for that, for the electrocautery. But those are ways to more aggressively solve the bleeding episodes on a more permanent, long-term basis. And so if you have any questions, make sure you ask them below and make sure you subscribe and like these episodes that we're bringing to you. Thanks for joining me on the ENT Minute. We'll see you next time.